Welcome to Hiranya Medical Service. 5 minutes to a better health by our eminent doctors. Let's look at today's topic.
Hi, everybody. This is Dr. Gautham, and I'm going to talk to you about how the mind functions within the brain. Okay, today let us look at what this thing is that everyone calls depression. Depression is a very common term that is used by everybody. But do we really understand what it means? So before we can understand depression, we need to understand some basic concepts of the brain. These include brain networks, homeostasis, stress, and gene switching or epigenetics. The brain has various networks, as I had talked to you in the previous session. Now, some of these networks include networks for thinking, networks for attention, networks for focusing, and networks for execution. So whenever you want to do something, you first have to think about it. Then you have to attend on whatever it is that you want to do. Then you have to focus on that task, and then you have to carry it out. So the brain has these various networks, and these networks are all working together in order for you to think, to attend, to focus, and to carry out the task. The next circuit that we have to know about is about the reward circuit. The reward circuit gives us the pleasure. So whenever we do something, we get pleasure out of it. And that comes from the reward circuit. And then the last thing that we have to know about is about the impulse control circuit. Now, whenever we do anything, we have to control our impulses. There are so many things that we want to do, but there are certain things that we can do and we cannot do under certain circumstances. So we have to control our impulses, and there are certain circuits that control these impulses. So the brain has various centers that are dedicated to these circuits. Now, earlier in the previous session, I had talked to you about how the mind is like a suspension bridge within the brain. And the genes form the suspension of this suspension bridge. The next thing that we have to understand is about homeostasis. Homeostasis is the process of maintaining the balance of the brain suspension bridge. So our mind and our body are in constant balance all the time. The genes form the suspension of the mind bridge. The genes create protective factors within us, and they also create resilience within us. So this resilience, helps us to manage the stress of day-to-day life. Now, the stress of day-to-day life is brought about by what we call predisposing factors, or the situations around us that give rise to the changes within the mind and the body. The stable brain can take both light and heavy stress. So a person with a healthy personality, with few or no faulty genes, will have a stable mind, which we call normal. That means that they are able to adjust to things that go on around us all day long. Now, each circuit has a built-in voltage stabilizer. Now, this voltage stabilizer, just like the voltage stabilizer in our homes, whenever there is excessive current, the voltage stabilizer brings the power back to normal, or when there is low current, it boosts and brings up the power. So similarly, the brain also has a voltage stabilizer. So whenever there is excessive stress around us, it brings down the stress and stabilizes the mind. And when there is very little stress around us, what we call a state of boredom, then it tries to boost up the mind and stabilize it again. So this is the process of homeostasis. So when the brain is required to function beyond the range of control of factors around us, now that is called stress. So whenever there is stress, the brain begins to overact. The brain becomes hypervigilant. The neural connections between the various brain areas start working excessively, and the brain functions hyperactively. Now, this hyperactivity requires energy to maintain, and the energy is given by glucose, and the energy is churned out. The processors of the energy are the mitochondria within the cell. And there is also an increase in the cerebral blood flow, and there is activation of various circuits within the brain. Now, when the brain becomes hyperactive, there is also an increase in the stress hormone, and these stress hormones activate all parts of the body. So there is increased heart rate, there is palpitation, there is release of inflammatory cytokines, there is tremulousness, which we call anxiety. Now let us see what happens when there is stress on a normal brain. So first, there is a lot of thinking. We tend to ruminate, we tend to think a lot when we are stressed. Then there may be a lack of interest or a pleasure feedback, and we lose interest in what we are doing, and we feel dull. And when there is excessive fatigue, we start getting impulsive, irritable, or have angry outbursts. So when stress is of short duration, the brain returns to a stable internal condition. So this again is what we call homeostasis. So the brain is brought back to normal. But then let us look at what happens when there are certain faulty circuits and faulty genes within the brain. So the faulty genes produce faulty circuits, and this creates a susceptible brain. So this susceptible brain tends to start breaking when there is stress. So when there is continued stress and there are some faulty genes, the mind bridge begins to become shaky, and the voltage stabilizer is not able to bring the mind back to normal. So the voltage stabilizer begins to fail. And when this hyperactivity within the brain due to continued stress continues, there is a lot of things happening. So the autonomic hyperactivity is exaggerated. There is a lot of palpitation, there is sweating, there is breathlessness, there is increased intestinal movement, which we call irritable bowel syndrome. There are a lot of tremors, which we equate with anxiety. There is a high irritability. There are angry outbursts. There is impulsivity. We start doing things impulsively. There is impairment of a dynamic decision-making process. There is restlessness, and there is intolerance to noise, darkness, or invasion of personal space. So we resent it when people disturb us during this time, and there are also sleep disturbances. So this is what happens when the brain is under continued stress, and there are faulty genes and faulty circuits which prevent the brain from being brought back to normal by homeostasis. Now, if this stress continues, then the circuits become exhausted. We start feeling lethargic, we start losing interest in things, we have a profound sadness, we have crying spells, we have profound disturbances in motivational processes, and there is no interest in day-to-day activities, work, leisure activities. And if it continues, then we start feeling hopeless, worthless, and it can result in suicide-like. Now, all this happens on a day-to-day basis in all of us. Now, when there are faulty genes, these genes can be switched on and off by certain environmental triggers within us. So these environmental triggers turn on the faulty genes. So for each person, the environmental trigger differs. So literally, God only knows what the trigger is. So depending on your trigger, the stress factors within the environment will produce a breakdown in your circuits, and thereby it produces the symptoms. So let us see what is this thing called mild depression. Mild depression makes us feel sad, empty, and anxious. Now, the treatment for mild depression is to build up resilience, identify and manage predisposing factors, and manage the stress. Moderate depression is identified by loss of interest in activity, pessimism, hopelessness, worthlessness, fatigue, decreased energy, appetite, body ache, headache, and digestive problems. The treatment for this is medicines, psychotherapy, and re-engineering of the lifestyle. Medicines are very important because the medicines can bring about an immediate correction in the faulty circuits. Now, how do medicines work? Medicines work by working at various levels. Like we said, the genetics are what decide the wiring and the circuits, and we have the switches which turn the genes on and off. We also have the suspension bridge, which shakes and breaks under stress and strain, and all this is maintained through homeostasis. And medicines bring about a correction in all these things. They bring about a correction immediately in the short term, giving symptom relief through immediate neurochemical restoration of balance in the brain. In the intermediate term, they bring about changes in the neuron, changes in the switches that turn on the genes. And in the long term, they bring about correction of the faulty genes. Now, severe depression is identified by hopelessness, worthlessness, baseless guilt, thoughts about death, dying, and suicidal thought. And this requires admission, medication, and other therapies like ECT or physical therapy. So why do you need to seek professional treatment for depression? Because untreated depression can be extremely debilitating and it can lead to various other disorders. Appropriate treatment can alleviate the depression, and depression has been linked to a variety of illnesses. So depression just doesn't go away. Depression continues. Depression is there to stay and it has to be treated. Thank you.
Thanks for watching. Do like, share, subscribe, and click the bell icon button to receive instant updates.